DC Mayor Muriel Bowser. Our regularly scheduled program will resume following the announcement.
Good morning, everyone. I'm Muriel Bowser. I'm the Mayor of Washington, D.C. Today, I am providing an update on the district's response to COVID-19. We are also going to talk about another DC Healthy People priority that DOH will lead, DC Health will lead that discussion about the district's progress toward ending the HIV epidemic. And then we will take your questions. But I want to start with a personnel announcement. You can see that today we have been joined by another member of my cabinet, Dr. Roger Mitchell, who is the district's chief medical examiner. And Dr. Mitchell will be serving as well as the interim deputy mayor for public safety and justice. I announced last week that the deputy mayor that Kevin Donahue would be serving as my interim city administrator. And Dr. Roger Mitchell will now move in to serve as the interim deputy mayor for public safety. Dr. Mitchell is a recognized expert, a national expert in understanding and treating violence as a public health issue. He has a long history working in violence prevention, especially among vulnerable populations. That experience will help guide him and the cluster and reach across all of the government to assure that we are working together to create a safer and stronger Washington, D.C. Dr. Mitchell's work in the Office of the Chief Medical Examiner has been extraordinary in leading that agency to accreditation and national recognition, and we are grateful for his willingness to serve in this role as well. So thank you, Dr. Mitchell. Now let me shift to our COVID update. Here you can see the metrics that we track and release each morning. This morning we announced 55 new COVID cases, and sadly we also announced another Washingtonian has lost their life, bringing the total lives lost in our community since March to 601 D.C. residents. We continue to recognize the grief and trauma that this virus is inflicting. And as Dr. Nesbitt mentioned on Monday, next week we will be talking more about some of the mental and behavioral health resources that are available to all residents. This week, we are urging D.C. residents who need to apply or recertify for cash, food, or medical benefits to download a very helpful new technology tool. It's the DC Access mobile app to apply or recertify for cash, food, and medical benefits. Because the U.S. Department of Agriculture may end the automatic recertification of public benefits, district families who participate in the Supplemental Nutrition Assistance Program, also called SNAP, will be required to recertify starting in September. So please, listen up, download this app, pay very close attention to what will be required by the Department of Agriculture for recertification as soon as November. Please let your friends and family know about this requirement and this new tool as well. Residents can learn more about DC Access by going to DHS, our Department of Human Services, dhs.dc.gov/DC Access. We also want to make sure that our community knows about grocery distribution events happening tomorrow through the Catholic Charities. Tomorrow at 11 a.m., Catholic Charities will distribute 500 grocery boxes and ready-to-eat meals at the RFK Stadium, Lot 5. Each car will receive a package that includes nearly 20 pounds of food, including meat, fish, and fresh produce. This event is in addition to the regular daily meal and grocery distribution sites we have across the city, and you can see those locations listed on the screen. And we are in different locations in the city each day. Residents can find a full list of those sites by going to coronavirus.dc.gov/food. Now I want to hand it over to Dr. Nesbitt to talk about DC Health's annual HIV epidemiology and surveillance report, which DC Health released today. We've made good progress, and we also know that there are some resources and programs that Dr. Nesbitt wants to make sure residents know about. Dr. Nesbitt.
Yes. Thank you, Madam Mayor. Today we release our annual HIV epidemiology and surveillance report, which in addition to providing data on the status of HIV in the district, also provides data and information on the status of other sexually transmitted infections and tuberculosis, and in particularly also hepatitis in the district. On the next slide, you will see some of the key HIV indicators in the district and progress that we have made over the last 10 to 12 years. These indicators are things that are critical to the progress that we are making since the mayor released our plan to address the HIV epidemic in the district, what we often refer to as our 90-90-90-50 goals. You will see that we have made substantial progress since one of our critical benchmark years, 2007, where we've seen a 79% decline in the number of newly diagnosed HIV cases in the district. One of the things that we are extremely proud of is since we were given the ability, or I should say it differently, the restriction on the district for us to use our own tax dollars to have a needle exchange program or a syringe services program, we have been able to decrease by 99% the number of newly diagnosed HIV cases that are attributable to injection drug use by 99%. That is a significant achievement. And so it should not be understated the impact that needle exchange programs and syringe services programs can have on reducing the transmission of HIV in communities. It is notable that when a population or jurisdiction has more than 1% of their population impacted by HIV is what we refer to as an epidemic. And so that's why there's a lot of focus on HIV in the District of Columbia. And we have certain subpopulations in the district where that number is even higher than 1%, in particular for Black and Latinx residents, where in the Black community, residents are disproportionately impacted, where over 2.8% of Black residents in the district have been diagnosed with HIV. So as the mayor has mentioned, we've made progress, but one of the areas that is of concern for us is that our newly diagnosed individuals with HIV, while 59% of them have been virally suppressed, which means that the amount of virus in their system is not detectable. And that has occurred within 90 days for 59% of individuals in 2019, which is an improvement from 45% in 2018. However, our goal is to have that be at 90% for individuals overall. And the sooner that occurs, the better. So while this is our 90-day benchmark, we know that this indicates that not enough people are getting into treatment in a timely manner. And so they therefore have the opportunity to continue to transmit the virus to others. And so we want residents to know about linkudmv.org, which is an online directory that provides individuals with a full suite of services that are available, including medical and community provider services that can assist with the other things that we know enable people to be successful with their HIV-related treatment, such as health, sexual health, food and nutrition services, and transportation services. We also help people with financial assistance, education and employment, and all of the other social and structural determinants of health are part of the comprehensive HIV wraparound services. You will notice that it is linkudmv.org. And over the past several years, we have been able to modify the way that the program is delivered, such as the benefits. Many of the benefits in the program are portable across the jurisdiction, recognizing that individuals who are diagnosed with HIV in the district may move into the other counties in the National Capital Region. So many of the providers who are listed on linkudmv.org are able to provide services regardless of the individual's residency. On the next slide, we just highlight our progress toward meeting our 90-90-90-50 goals by 2020. As you can see, we have, by 2019, met our goal of having 90% of HIV-positive individuals know their status. We still have some gains to make in ensuring that 90% of district residents who are living with HIV are in treatment. 90% of district residents living with HIV who are in treatment reach viral suppression, and then 50% reduction from our baseline year of 2015 in new HIV diagnosis. More details about all of these goals and the different initiatives that are in place to meet these goals can be found in the full report. One of the things that we have been doing since COVID to be able to ensure that individuals will know their HIV status, can quickly get into treatment to assist them with achieving viral suppression, we have initiated an at-home HIV test kit program for DC residents. Residents can receive this free kit by going to getcheckeddc.org. The kit will be mailed to them, and they can self-swab their mouth and get a result in 20 minutes. Because of all of the comprehensive ways that we communicate with individuals, all of the support that they will need for both a positive diagnosis, but also we treat a person who is status neutral, which means a negative result. We still provide them wraparound services, including making them aware of our pre-exposure prophylaxis programs, which are for both men and women in the district, to be able to further reduce their risk for HIV transmission. So lots of things that are happening in the district. We do have, again, promote all of the things that have been put in place, such as the increased use of telehealth services to continue to have people be engaged in healthcare services in the face of COVID-19, distribution of at-home test kits, and we continue to work with all of our healthcare and community partners so that we may continue to make progress on the HIV epidemic in the face of this pandemic. So with that, I'll turn it back to you, Madam Mayor.
Thank you very much, Dr. Nesbitt. And I remember when we were at Whitman Walker announcing these goals and all of the people who have worked so hard in all aspects of our healthcare community to get the district to where we are with HIV. Still, we're not where we want to be. The goals have been very simply laid out, and DC Health and so many of our partners have been working to spread the message that you can live with HIV, you can suppress you can suppress your viral load, and you can make sure that you're keeping others safe by a number of means. So by all means, know your status. That continues to be the best way to protect our community and our public health. And I learned today, actually, about the free at-home HIV test kits, which you can take in the privacy of your own home and know your results. And be able to connect with DC Health, regardless of the result, to keep our community safe. So please go to getcheckeddc.org for more information. And I want to thank our team at DC Health and all of our partners, because we have a lot of partners who have been engaged in this work with us to keep DC residents healthy. So with that, we will take COVID questions, the HIV report, and general questions. Yes, Sam?
For Dr. Nesbitt, so there was obviously a decrease, looks like about 17% of new cases last year to, 2018 to 2019. Is this the same for other transmittable diseases? And my other question, which I've been asking you continuously, is does it seem that COVID is having an effect in decreasing various sexually transmitted diseases in the city?
Yes, so we have, I'll start with your last question. I do not have an answer for you yet on whether or not we will see a decrease in sexually transmitted infections from 2019 to 2020. And even if so, it will be difficult to say if that is attributable to COVID. We have some of our sexually transmitted infections, like syphilis, for example, that does not show consistent upward or downward trends from year to year. We have seen an upward trend in gonorrhea and chlamydia over the past several years. And so some may want to speculate that seeing a decrease from 2019 to 2020, that COVID may have a impact, or may be one of the factors that contribute to that decrease, because people are social distancing. But it would be difficult to say that definitively. The reason why I say that,
I'm not clear.
I said I don't know. We don't have that data. That was the point I started with.
One thing that I want to highlight, Sam, because I wasn't sure of this either, but anytime especially with this pandemic, I get concerned about our young people. And Dr. Nesbitt assured me, and can you say a little bit more about this, Dr. Nesbitt, that the school-based health, that some of our young people are used to having access to every day going to school, or if they're having any issues related to their sexual health, they could also address. So Dr. Nesbitt will say more about that.
So we have continued to work with our school-based health centers and also our community health providers who provide what we call adolescent-friendly services to ensure that those services continue to remain open and available during the pandemic, and even as we begin the school year with remote learning or virtual learning. And we have had some enhancements to our school-based health centers on a regular basis, is the phrase I will use. The school-based health centers are open to the students who attend that particular school, and if they are parents, to their children. This year, we have worked collaboratively with the DC Public Schools to make those school-based health centers open to a broader swath of students and community members, so that we can increase access to healthcare services throughout the community.
And young people are using them?
We will be monitoring the utilization data. So some of these decisions, policy decisions to increase access to school-based health centers, are newer policy decisions.
Yes.
Mayor Bowser, there was a COVID outbreak at the Petite Scholars Daycare Center in Brooklyn a few weeks ago. It affected 6 families and 3 teachers, and the center had to be shut down for a few weeks. I'm just wondering what your understanding is, what happened there, how the district is handling it, and whether this is indicative of a larger trend among daycare centers.
Dr. Nesbitt, can you speak to that?
So we have worked very hard in the district, and one of the collaborative efforts that we took was to ensure that our child care facilities could remain open In particular, we have a high number of essential employees, critical infrastructure workers in the District of Columbia. We have guidance on our coronavirus.dc.gov website for all of our child care facilities to follow, both in phase 1 and phase 2, which we are currently in. We have a team that's called the Epidemiology and Investigation Team at DC Health that routinely works with any sector, whether it be schools, child care centers, summer camps, anytime that there is as many as 1 cases of infection at any of those facilities. In the particular case that you are referring to, that I want to make sure I'm making a correction for the record, there was not a closure for several weeks. Every case we deal with on a case-by-case basis, and we do a notification. The public should have a reasonable expectation, given the pathology of this virus, that if 1 case is identified and people have to quarantine, that there could be additional cases related to that 1 single case. That is why we work very hard to have people quarantine and isolate after their case has been identified. So we work with them. Given the number of child care facilities that we have in the district, given how critically important it is for child care facilities to be open and operational so that our members who are our residents and others who work in the district are for critical infrastructure, first responders, healthcare workers, educators, people who work in our food retail industry, the guidelines that we have are appropriate for those child care facilities to operate. We go into those child care facilities, we make sure that the screening processes that they have are appropriate. I'm sure all of you are very much aware that we don't recommend putting masks on anyone who is less than 2 years of age. And even for those who are older than 2, there may be challenges with how well they comply with wearing a mask. And so there's a number of other hygiene things that we pay attention to, including the number of individuals per classroom. And so we go in and we make sure that compliance is happening with all of those things, disinfecting is appropriate, but also that the appropriate social and emotional development activities can be occurring in that environment. And so that's how I'll make sure that we're communicating about that specific incident, and also communicating to the public that we believe that the appropriate level of risk is occurring in those environments for people to be able to use child care and daycare facilities for them to carry out their activities of daily living.
So, but what happened in this instance? I mean, were they following all protocol and this still happened? Did you find any breaches in protocol?
We conduct an assessment and provide feedback directly to the facility.
Okay, and are you seeing this trend among other daycare centers in the city? Are you seeing any other COVID outbreaks in Cape?
It is not the only facility in the city where we have had a case of COVID-19.
How many centers have had cases?
I'll have to get you that later.
Thank you.
Yes.
In terms of the HIV report, the disproportionate impact on Black and Latino residents, can you say what underlying factors are there that is leading to that? And do they share any similarities in terms of disproportionate impact of COVID as well?
Can you repeat your question?
Yeah, just have you been able to identify the underlying factors that is leading to the disproportionate impact on Black and Latino residents here in DC?
Sure. So we published a health equity report out of DC Health, and we have 9 key drivers of health inequities that we focus on, and they are essentially the same for any health condition where we are seeing disparities and inequities. They're rooted not only in access to healthcare services defined by a host of dimensions, not just in in the district where nearly all of our residents are insured. About 98% is the second highest in the country. There can be differences in quality of care, how people define the accessibility and cultural appropriateness of the care. But that access to health care is only one dimensional domain. There's 8 others. So things like transportation, food access, health, community, housing, community safety, environmental factors. So I'd encourage people to look at that health equity report. So when we talk about things like why do these disparities exist, we have to take a holistic approach to talking about disparities and recognize that there are short-term things that you may be able to do to focus on specific populations, but this is really a long game of having to deal with a host of things that befall communities of color, in particular Black and Latinx populations, including structural and institutional racism and some issues related to mistrust of the healthcare system and governmental institutions. Any other questions?
At all?
Yes.
I noticed you introduced Dr. Mitchell.
Yes.
And in that you said that he looked at violence as a public health matter.
Yes.
I would just be interested in what he has to say about it.
Absolutely. So let me, before I turn to Dr. Mitchell, mention that a couple of years ago, maybe 3 years ago now, I convened a Safer, Stronger Working Committee that was chaired by Dr. Mitchell and Dr. Nesbitt to examine the public health implications of crime and to create recommendations around dealing with that. So we spent the better part of a year looking at all of DC government in our neighborhoods and the things that we have that concern us, and we implemented new strategies based on those recommendations. So let me turn to Dr. Mitchell.
Good morning. Thank you, Mayor. Yeah, so violence as a public health issue, I think that just on the heels of what Dr. Nesbitt just described as disparate and lack of equity in many sectors that lead to poor outcomes in health, those are the same contributors that we see in violence as well. And so when we're talking about how we remedy violent behavior in community, we have to take a holistic approach. So this is a great opportunity for us to look across sectors, look across agencies, look across clusters, and de-silo the work in a way that we are looking at what we're already doing through the lens of violence prevention, but also opportunities to do things a little bit differently. So we'll be building upon the work that has been done by my colleague Kevin Donahue, an interim city administrator, as well as the work that's being already done in the Office of Neighborhood Safety and Engagement, Metropolitan Police Department, DYRS, Department of Corrections, education, jobs, housing. All of those things require a comprehensive approach. So I'll be here in the time that the mayor would have me serve in a way that de-silos that work and really allows for communication across all sectors of government towards a remedy for violence in our community.
And as a deputy mayor, what can you do? I mean, you talk about housing, health. Obviously, you've got a certain thing that you can do. But.
Absolutely. So, I think my main role is to convene. Right? My main role is to convene, to hear, to compile, and to set vision and strategy that is aligned with the mayor's commitment to dealing with violence as a public health issue and a criminal justice issue. We have to be clear that law enforcement plays a major role in violence prevention in this city and throughout the country. And so, so my goal is to convene and to empower solutions and to lead us in a place where we can actually get some additional outcomes because we've made some significant strides.
And the mayor mentions in her press release that you're a minister, right? A religious person. How does that play?
Well, it influences everything that I do, Sam. So I hope that it benefits the city. I hope that it benefits my colleagues that I've worked with in this cluster for the last 5 years, and I hope that it benefits the outcomes.
Well, you mentioned, this is a question for the mayor, I guess, you mentioned forming vision and strategy. Is there a timeline in terms of finding a full-time deputy, or is the plan moving forward just interim for as long as he needs to be?
No, I haven't set a timeline yet. But we're led by very capable people, and when the time comes, we'll have a timeline. Yes.
If I may ask two questions. First, Dr. Nesbitt, could you tell us more about how the pandemic has affected the health department's ability to get people to know their HIV status and get people into treatment, get people PrEP when they need it?
So I'll if you allow, I'll broaden the question. We have, since the beginning of March, in our conversations with our healthcare partners, seen some changes in how people have utilized healthcare services broadly. And we would conclude that the individuals who have already been diagnosed with HIV and individuals who need to seek care to know their status for HIV would be included in this population. And our policy decisions that we have made across the government for individuals, those of us in leadership in the Health and Human Services cluster, as well as some who make policy decisions around insurance, have been very attentive to these care utilization pattern changes. The healthcare delivery system made some modifications to be able to adjust for patient safety and quality. And in doing so, needing to triage patients who may have had signs and symptoms of COVID-19, such that there would not be mixing of patients who had COVID-19 and patients who needed to come in and receive prenatal care, or patients who were coming in for well child visits, or patients who had chronic health conditions or a diagnosis of cancer, not wanting them to be in the same environment as someone who potentially had a highly contagious and potentially fatal infectious disease, and until they could modify their clinical environment, we're doing a lot of triaging of patients, and that resulted in some of their clinical volumes declining. And they did a yeoman's job in prioritizing who needed to come in, who could have a telehealth visit. We made policy changes to compensate or reimburse for different types of telehealth services, audio only. What that really means, y'all, is that you could call and have a doctor's visit on a phone. Whether or not it was audio and visual only, which is using iPads in a very different way to deliver health care, and then who really needed to come in person. That has some of our healthcare providers reporting that their volumes now are 60% of what they were this time last year. And so people who were coming in for their annual checkups is diminished over what was happening this time last year. So we anticipate or expect that that has some people who were coming in for an annual checkup, and that annual checkup may be where they were getting their annual HIV test, is likely reduced, which is why we're doing things like having people have a HIV test kit mailed to their home and being able to get a result at home. For people who are already in HIV care, we know that those healthcare providers prioritize bringing them in, prioritize having them go and get their labs if labs are indicated, prioritize making sure that they are getting their medications refilled, prioritize them for case management, and helping them to stay on track with viral suppression. So we're not necessarily seeing any declines in their health outcomes, but it's the individuals who don't yet know their status and them being able to get in for an appointment, or them going in and getting a test with the same frequency that they would have been getting in a pre-COVID environment. So initiatives like this free at-home HIV test are where we're really focusing on still being able to capture that population.
Thank you. And Mayor Bowser, do you have any more information about the Republican National Convention next week? Any events we can expect in D.C., any precautions you're taking with regard to safety and crowds?
I think that they have, the RNC has announced the events. We have engaged the process that we go through for large events. This is belated planning, but that planning is underway nonetheless. So I want to ask Director Rodriguez, who leads DCHCMA, to talk about that.
Yes, thank you, Mayor. As the Mayor mentioned, this is a bit of a belated process, but the Mayor Special Events Task Group, along which comprises members from MPD, from FEMS, from HCMA, and all other relevant agencies that carry out or help to carry out these events, have been engaged with the RNC and will continue to be engaged with them over the coming days as their convention begins.
Can you tell us what we should expect, like venues they'll be using, places there might be large crowds?
So for that, a lot of that is on the RNC website in terms of their events and what they're going to be doing. Again, as we engage with them over the next several days, we'll adjust our operational posture as well to ensure a safe event.
Do you expect protests?
At this time, we've had no permits for protests or counter-protests, but we're going to continue to monitor that over the next several days.
Thank you.
Yes, Sam.
Mayor, a couple more things. We saw you and Congresswoman Norton and Council Chairman Mendelson nominating Joe Biden the other night for the District of Columbia. I'd like you to comment on the convention, if you would. This tweet we're seeing of Tucker Carlson saying that the people are leaving DC in droves, and then finally the Chuck Brown virtual festival this weekend.
On the convention, I think that for many people, it's certainly a different way to watch, which is something that is largely like kind of the inside party, how should I say, activities that usually happen in a big stadium with lots of events that surround them. And then there is the TV presentation that accompanies it. So this year's quite different. It will be different for the DNC, and it appears that it'll also be different for the RNC, for the Republican National Convention as well, where the TV show is it. I think that I have been struck by the ability of the speakers to be right in your face, right in your living room or wherever you're watching, and that connection is a different one. I think that probably the most striking thing over the several days, and I'm not going to comment here too much on the content of the speeches, but the most striking thing was listening to people, Americans all over the country, delivering their delegates, and realizing how much I missed being able to think about going and visiting other places. And it was like traveling around the country. It was marvelous. And Dr. Nestor probably really liked it. But it was good to see the diversity of our country, but also the diversity of people who care about our country and care about making a change. So that was quite remarkable. The last thing I'll say about it was seeing Kamala Harris accept the vice presidential nomination, I thought was a huge step for our country. Her story is an American story of, in my view, a quintessential American story of family, hard work, sacrifice, leading to the point where she is today on the precipice of going to the White House. So I feel very proud about that.
Tucker Carlson's comments?
I only saw a snippet of Tucker Carlson's comments, and the snippet I saw was, it was erroneous. People are not leaving D.C. in droves. In fact, D.C. is still one of the hottest places to live in America.
And the Chuck Brown virtual celebration is.
I'm not familiar with that, Sam.
Okay. Apparently, it's going to be on Channel 16, and they're not going to actually be at the park this year.
Oh, there's a number of things that our Office of Cable Television and Music is moving forward with in a different way. Sounds like, is it already time for Chuck Brown Day? Years going by so fast. So yes, Chuck Brown Day would be done that way. In addition, we've also made announcements, or will be making an announcement soon, about the Mayor's Arts Award which we're also planning to do virtually. All right, thank you, everybody.